Hi, everyone, and thanks for being here. My name is Brett Cantrell, and today I'm going to be talking about a critical issue that affects many of our friends, neighbors, and families, and that's mental health care in the Texas Panhandle. I hope this teaching plan brings more awareness and solutions to light for the problem. Mental health is a growing concern across the United States, but in Texas, particularly the Panhandle, it's become a crisis. We face a shortage of providers, limited resources, and systems that are hard to navigate. This presentation is designed to empower our community with knowledge, helping individuals identify mental health challenges, understand what support is available, and explore ways to manage mental health care outside of a clinical setting. Here's what I aim to do today. First, I want to educate community members on the mental health issues that we're facing. Then, I plan to share local resources where people can turn to for support. I'll also offer some practical everyday strategies for managing mental health outside of a clinical setting. And finally, I hope to gather feedback from you to help improve future community education efforts. Texas has consistently ranked at the bottom nationwide when it comes to access to mental health services. Recent data from 2024 shows that 246 out of our 254 counties are designated as mental health professional shortage areas. That's nearly the entire state. In the Panhandle, this means residents often must travel long distances or wait months for care. We need to raise awareness and equip our communities with the tools they need to cope and seek help. For many, even those with insurance, the cost of care is simply too high. It's no surprise that in 2022 alone, over 4,300 people died by suicide in the state. Mental illness refers to a variety of conditions that affect mood, thinking, and behavior. Some of the most common ones include depression, anxiety, bipolar disorder, schizophrenia, and PTSD. These conditions are treatable and in many cases manageable with the right support. But first we have to know what we're dealing with, and that starts with education. Mental health doesn't exist inside of a vacuum. It's shaped by our environment. Social determinants like poverty, limited access to care, lack of education, discrimination, and isolation can all contribute to or worsen mental health. In rural areas like the Panhandle, these factors are magnified, especially when healthcare is miles away and jobs are scarce. Fortunately, we do have some good local resources here in Amarillo. The Texas Panhandle Centers offers mental and behavioral health services. Hilda City offers free medical care, including mental health. And Northwest Texas Healthcare System has a behavioral health division with both inpatient and outpatient services. These organizations are here to help, many on a sliding scale or for free of charge. Those in need can also utilize the National 988 suicide hotline for emergencies or be linked to services in Texas by dialing 211. Better yet, even more help is on the way as there's a new $160 million, 75-bed behavioral health hospital due to be opened in Amarillo by 2027. Next, I'd like to break down the three levels of mental health prevention. Primary prevention is all about stopping mental health problems before they even begin. Think education, coping skills, and reducing stigma. A good example of this is teaching children how to manage and cope with their emotions. Secondary prevention kicks in when problems are just beginning. This focuses on early detection and getting people the help they need quickly. A good example of this is mental health screenings during primary care visits so that mental health issues can be identified early on and then treated. Tertiary prevention supports those already living with mental illness. It's all about reducing the impact, helping with recovery, and preventing future episodes. Here's where we want to link those that are suffering to resources to help them manage their care. It's also important to talk about how mental health affects our children. Childhood trauma, abuse, and neglect can lead to long-term mental illness. Over 13% of children and teens nationwide experience mental health issues, and suicide is now the second leading cause of death for youth ages 10 to 14, and third for ages 15 to 19. Public schools are responding with new initiatives like mental health screenings, peace rooms, and counselor-led programs, but they can't do it alone. Communities have to be part of the solution too. Next, I'd like to discuss some of the comorbidities of mental health disorders. According to a study by Javed and colleagues in 2021, there are several shared risk factors between mental health disorders and chronic physical conditions like diabetes, cardiovascular disease, and cancer, including substance abuse, poor diet, physical inactivity, and poverty. The study also points out that the stigma surrounding mental illness discourages people from seeking the help that they need, and when mental health goes untreated, it can actually make chronic conditions worse. In addition, individuals living with mental illness are more likely to engage in poor health behaviors, be non-compliant with treatment plans, and experience weakened immune systems. Lastly, the connection goes both ways, as patients who have chronic illnesses are often more likely to develop mental health problems like depression and anxiety. In many cases, especially during crisis, emergency departments are the only place that people can turn to for help. As an emergency department nurse, I see this far too often. While they're not ideal for long-term mental health care, they are critical for stabilization, especially when other resources may not be available. This reinforces the need for expanded outpatient services and follow-up care once a crisis has passed. Emergency departments are key in providing these outpatient referrals. However, inadequate can lead to overcrowding in the ED, higher healthcare costs, and poor outcomes for patients suffering from mental health illnesses. For those who cannot afford or access clinical care, other options exist. Telehealth has been a game changer, especially for rural Texans. It allows patients to speak with licensed professionals from home and is oftentimes cheaper than in-person sessions. Support groups, whether virtual or in person, offer valuable space for communication and connection. And community and faith-based initiatives also provide emotional support, filling in the gap of formal services. These alternatives are keys to increasing access and reducing stigma for mental health issues. When professional care isn't an option, there are still many ways to promote mental health. Physical activity, eating a healthy diet, and getting enough sleep all play a role in stabilizing mood and managing stress. Practices like mindfulness and breathing exercise are accessible and evidence-based interventions to support mental well-being. Even simply spending time outdoors, what researchers have been calling green therapy, can reduce anxiety and boost mood. Nurses are on the front lines. We see patients daily who are struggling emotionally, many of whom don't have a diagnosis or know where to turn. Nurses can act as educators and early responders. By recognizing the signs of distress, we can connect people with help and offer immediate coping strategies, especially in underserved populations. In conclusion, mental health challenges in the Texas Panhandle are real and urgent, but not insurmountable. Through education, awareness, and creative resource use, we can make a difference. Let's keep pushing for access, supporting one another, and working towards a healthier, more informed community. Thanks for being part of this effort. These references provide the evidence for the basis of this presentation. All sources are from within the last 5 years and reflect the most current data and recommendations from leading organizations. I'm happy to share these with anyone interested in learning more.